welcome you all to today's session. Myself Rajita, and here in today's session I am present with a new topic of medical surgical nursing. Now in previous session we have discussed regarding incontinence. In there we have seen basically two type of incontinence will be almost always or commonly present as a symptom among the patient. Now this includes urinary incontinence and fecal incontinence. So first we have discussed in detail about urinary incontinence. Now in this session of today's we are going to learn regarding the next topic of incontinence, that is the fecal incontinence. So as in urinary incontinence we have seen it is basically a involuntary passage or leakage of the urine. So the same way the fecal incontinence stands for an involuntary passage or leakage of stool. So it occurs when the normal structural functional ability of the part which basically controls the involuntary activity of defecation is getting disturbed. So as we know, the nervous system and the muscular system have a effectivity over controlling the anal sphincter and the passage of stool, basically the process of defecation. Now we also know that it is basically a involuntary condition or involuntary procedure that is occurring in an individual's body. Now here we're going to learn that this particular fecal incontinence will only be occurred if there is any abnormality or there was any disturbance into the anatomical and physiological activity of the structure related to the defecation process. So defecation is a involuntary process when the neuromuscular system is intact. Now, once it is getting altered, we are going to see a person will be complaining about the leakage of stool. Now, definitely, not only the or neuromuscular abnormalities, there can be certain other disease conditions which will be ultimately developing the condition of fecal incontinence. So here, let us study now regarding the causes or basically the etiological factors which are almost always will be associated with the development of fecal incontinence. So first, there will be definitely problems with the motor function or the sensory function or a combination of the both will be leading to the development of fecal incontinence. And the abnormal function or functional ability or the motor function disability or the sensory function disability or the combination of both, these three are considered to be the major risk factor or causative factor to develop the condition of fecal incontinence. So when we are going to see there will be disability of the motor function, we are definitely going to see the contraction of the sphincter basically of the rectal floor muscles will be altered. And as the contraction is not properly taking place for the rectal floor muscles, we are going to see there will be a disability of the sphincter to have a proper closure. And that is when a person can present with fecal incontinence. In the next, we are going to see the alteration will be there in the sensory function. So here, a person will be disabled to perceive the presence of stool or experience the urge to defecate. Now, if there is such a problem or disease condition basically related to the neurological condition where a person is not able to sense the urge of the defecation, or whether they are having or they're not having a sensation regarding the presence of or accumulation of the stool, then we are going to see this sensory disability of a person can lead to the development of fecal incontinence. Now the next cases we are going to see there can be the factors where both the motor function disability and sensory function disability will be present in a combination. And then also we are going to see a person will be more likely to develop with fecal incontinence. Now, these are where the main factors or main etiological factors which are contributing to the development of fecal incontinence. Now we are going to read about contributing factors. So what are the contributing factors will be there which will be increasing the chances of the development of fecal incontinence? So first word includes the weakness and disruption of the internal and external anal sphincter. So as we know, the internal and external anal sphincter is very important part to maintain the involuntary passage of stool or to maintain the defecation process. Now, once there is any weakness or disruption of their functional ability, definitely we are going to see the closure of the sphincter will be disturbed here, and then a person or individual will be more likely to develop with fecal incontinence. The next contributing factors is considered as damage to the pudendal nerve. So pudendal nerve basically often will be controlling the rectal floor muscles, weaknesses and strength. So even it will be controlling the sphincter contraction and relaxation. Once there is any disease condition which is causing damage to this pudendal nerve branch, we're going to see this ultimately will be causing the development of fecal incontinence for the individual. Now, the third contributing factor is definitely the damaging of the nerves which are present or which innervates into the anorectal area. So, as we know, in the anorectal area, there are presence of various nerve branches, now which also will be able to maintain the strength or to maintain the tension of rectal floor muscles, even pelvic floor muscles, and the muscle tone of other associative structure which is related to the defecation process. Now, damage in any of this nerve due to any surgical trauma or due to any traumatic injury or any other disease condition can ultimately leads to weakness of the nerve branches into the anorectal area. Ultimately, this damage will be going to cause the development of fecal incontinence for the individual. The next contributing factors includes damage to the anal tissues. So as we know, anal tissues are definitely will be having or will be a related structure which will be maintaining the defecation process in an individual. Now, any damage into the anorectal tissues, basically to the anal tissues, will be alternating the process of defecation, and ultimately it can lead to the development of fecal incontinence. Next is trauma to the puborectal muscles. So often we are going to see if there is any muscular trauma has been taken place into the puborectal area, a person will be more likely to suffer from fecal incontinence due to loss of muscular tone into the perineum and the rectal area. So I hope till here you are completely clear about the main pathological process which will be occurring, that is basically the disability or abnormality of the motor function and abnormality of the sensory function, or a combination of both, which will be majority of the cases will be contributing towards the development of fecal incontinence. In the second, we have seen the contributing factors which will be almost always will be increasing the likelihood to development of the fecal incontinence for individual. Next, we are going to read about certain absolute causes of fecal incontinence. Basically, this absolute causes means the presence of certain disease which will be definitely increasing the likelihood to the development of fecal incontinence. So now let us study related to the absolute causes, basically the absolute disease condition which is causing the development of fecal incontinence. So first we are going to see certain traumatic injuries disease which will be often causing alteration into the defecation process and will be causing the development of fecal incontinence. So it includes the anorectal surgery for basically the condition like hemorrhoids, fistula, even fissures. So you need to understand a person who is suffering from hemorrhoids, fistula or fissures, if it is getting into a severe condition, often we are going to see the person needs a surgical management. Basically, a anorectal surgery would be performed for the client. And definitely, it is one of the major and common traumatic cause of the development of fecal incontinence. The next is exposure to radiation. So it is suggested that the exposure to the radiation, basically if direct radiation has been used into the puborectal area for a prolonged time as a therapeutic measure, often we are going to see the client will be more likely to suffer from fecal incontinence. It is considered that the radiation therapy will be affecting the muscular and nervous tone and functional activity. That is how the sphincter actually can lose their ability to have a proper closure. And if this radiation therapies is having a prolonged effect, a client may develop with the condition of fecal incontinence. Now, the next causes is the childbirth injury. Basically, a traumatic childbirth, or maybe while childbirth, if any surgery has been performed into the vaginal area, basically the episiotomy, which is a very common surgical method, would be done to promote the vaginal delivery of the baby from a woman. Now, this episiotomy surgery have a major effect to develop the condition of fecal incontinence, because often we are going to see this procedure of episiotomy will be affecting the muscular tone in the puborectal area, which ultimately can develop the condition of fecal incontinence. The next one is the perineal trauma or pelvic fracture. Now this both can ultimately can alter the functional ability of the muscular structures or the sphincter and the nervous structure associated with the involuntary process of defecation. Once there is traumatic injury to any associative structure of the defecation, we are going to see the client is more likely to suffer from fecal incontinence. Next, we are going to read about the neurological condition. So neurological condition often will be causing alteration into the nervous function, or nervous system function will be altered, and this ultimately can lead to the development of fecal incontinence. So let us study here what are the major neurological conditions can develop the condition of fecal incontinence. So first it includes brain tumor. So brain tumor can affect many of the nerve branches, as well as it can affect the motor and sensory functions of different nerve branches. Now, in a proper location, if that brain tumor is present, which is innervating the nerve of the area of the puborectal place, we are going to see those nerve branches, if it is affecting by the presence of brain tumor, will be often cause the development of fecal incontinence. The next disease condition, which is a very common condition, is the cauda equina nerve injury. This will be almost always associated with the inability of the nerve to maintain the sphincter control into the anorectal area, which will be ultimately increasing the chances of the development of fecal incontinence. The next condition is certain congenital abnormalities. Now, this congenital abnormalities can cause some abnormal structure formation into the anorectal area, which ultimately can lead to the development of fecal incontinence. Dementia also can cause the nerve to decrease their effectivity or their working ability. That is how dementia also can cause alteration into the nerve endings and nervous activity, which will be ultimately leading to the development of fecal incontinence. Diabetes mellitus, this basically, as a complication of diabetes mellitus, often the person or a particular individual is more likely to suffer from diabetes neuropathy. Now, often this diabetes neuropathy will be causing alteration in the functional ability of the nerve branches, mainly into the puborectal area, which will be ultimately causing the chances of the development of fecal incontinence. The next come is multiple sclerosis. So as we know, multiple sclerosis often will be affecting the nerve and the nervous system. So definitely it will again can cause disability of the nerve to maintain the tension within the anorectal and puborectal area, and also it will be causing abnormal closure and opening of the anal sphincter, which ultimately will be leading to the development of fecal incontinence. Now, spinal cord injury and stroke also considered to be one of the major important disease condition which will be affecting the nervous system and nervous branches in the puborectal area, and ultimately will be causing the development of fecal incontinence. Now we are going to read about certain inflammatory condition which will be often increasing the likelihood to development of the fecal incontinence. It includes the presence of infection mainly to the puborectal area. Now, as we know, infection often can cause inflammation to a localized part, and if the infection is associated with the rectal or puborectal area, we are going to see it will be ultimately can alter the wall or the layer of the rectum area, which will be causing an inflammation to that localized part, and ultimately it will be causing the development of fecal incontinence. The next condition is inflammatory bowel disease. Now, it is basically a gastrointestinal system associated disorder or dysfunction. So, this inflammatory bowel disease often can lead to excessive amount of the production of stool or fecal matter, which will be ultimately causing the fecal incontinence. The next condition includes the pelvic floor dysfunction. So pelvic floor dysfunction often will be causing decreased muscle tone into the puborectal area, which will be ultimately will be causing the development of the fecal incontinence. Among that, the major condition or the common condition which will be associated with the pelvic floor dysfunction and the development of fecal incontinence include the rectal prolapse. The functional causes here includes the physical or mobility impairment, which will be affecting the toileting ability of an individual. This functional cause also passively will be developing the condition of fecal incontinence. Now, other condition includes chronic constipation. Chronic constipation often will be causing seepage of the liquid stool material from the anorectal area, which can ultimately lead to the development of fecal incontinence. The next part or the next main causes is diarrhea. So as we know, in diarrhea the consistency of the stool will be in a very liquid manner, and there will be sometimes no proper sensation of the urge of the defecation, and there will be presence of fecal incontinence majority of the time. Denervation of the pelvic muscles often will be causing decrease in the muscular tone. Ultimately, that will be reducing the sphincter pressure, or the ability of the sphincter of the contraction and relaxation will be reduced here. Ultimately, that will be increasing the chances of the development of fecal incontinence. The next condition is fecal impaction. So, fecal impaction almost always will be causing, in a severe way or in a severe stage, this fecal impaction ultimately can cause the development of fecal incontinence. The next cause, or which is very commonly associated with the development of fecal incontinence, includes the loss of rectal elasticity. So as we know, our anorectal region will be having a elasticity which will be able to manage the sphincter closure and opening, as well as it will be also helps an individual to sense the urge to defecate. Now, once there is loss of rectal elasticity, which will not be able to accommodate with the production of adequate amount of stool, ultimately can cause early opening of the rectal sphincter, which will be ultimately can cause the development of fecal incontinence. So as we have learned regarding the all the related causes which will be developing the condition of fecal incontinence, so I hope you got the idea that all of these causes will ultimately causing a motor or a sensory dysfunction, where, or a combination of both, where a person will be not able to feel the urge, either the person will be not able to have a voluntary control over the sphincter opening and closure. That is when a person is more likely to develop with fecal incontinence. So, the clinical manifestation often will be including abnormal leakage of the stool from the rectum area. Even often, a client will be seeming very anxious, and they will be often complaining about discomfort. They will be having even low social esteem or low self esteem. That is how these are the basic clinical features will be associatedly present with this particular symptoms of fecal incontinence. Now we are going to learn about the diagnostic studies. So diagnostic studies basically will be definitely contained a detailed history collection and a thorough physical examination. So history collection and physical examination will be helping a medical professional to identify the probable causative factors or associative factors associated with the development of fecal incontinence. So, information related to the past and present medical history, past and present surgical history, a family history, even a lifestyle history should be taken. Now, the information should be also collected about the number of incontinence episodes or per week. So basically, this would be suggesting the severity of the fecal incontinence among the client. The next condition or the next information should include the stool consistency and the volume. So definitely a client would be asked here, or basically the caregiver of the client can be asked here regarding the stool consistency and the presence of the stool volume in each defecation episodes. Also here it is a very important role of a nurse to assess the degree of the incontinence which will be interfering with their work and social activities. This basically helps a person to understand the severity of the fecal incontinence. Depending on this history, definitely a proper plan of care and management would be planned for a particular individual. Now, physical examination, definitely a head to toe examination would be done to identify any systemic sign and symptoms associated with fecal incontinence. But focused rectal examination should definitely be performed over the individual to identify the problems associated with the rectal area or the puborectal area, where definitely a proper eye indicator can be found out, which will be suggesting the probable causative factor associated with the development of this disease. So often on rectal examination, we are going to found, or there will be revealing of reduced anal canal muscle tone. Now, definitely we are going to see there will be decreased muscle tone, which is causing the fecal incontinence. So sometimes if there is presence of decreased muscle tone, a proper plan of care can be made for the patient. The next finding, which is very commonly found among the client with fecal incontinence, is decreased contraction strength of external sphincter. Now, decreased contraction strength of external sphincter often will be causing the development of the fecal incontinence. The next includes the detection of the internal prolapse or any organ prolapse into the rectovaginal area. Now, often while performing a rectal examination, we are going to see whether there is presence of any internal prolapses there or not, which will be indicating the probable reason of the development of fecal incontinence. Next, we are going to see the hemorrhoids often will be present among the client, which will be ultimately leading to the development of fecal incontinence. So, management of the hemorrhoids also plays here a very important role to manage the symptoms of fecal incontinence. Even when performing the rectal examination, we should definitely look for the fecal impaction or the presence of fecal masses over the rectal region. Then, impaction in the higher colon will be almost always seen via the abdominal scan or CT scan of the abdomen. That is the reason often if there is any indication that the person may have fecal impaction into the higher colon, definitely abdominal scan or CT scan would be suggested for the client. Anorectal manometry would be done to understand the muscular tone and strength into the anorectal region. Anorectal ultrasonography also to be done if there is any presence of underlying disease process that would be definitely found out through the anorectal ultrasonography. Now, next we are going to see the usage of certain other diagnostic procedure that includes difficography. Sigmoidoscopy also would be used to visualize the sigmoid colon and the probable presence of the abnormalities, as well as we are going to learn about the process of the underlying disease process, which is almost always present associated with the fecal incontinence through colonoscopy. Now, this all are the diagnostic procedure which we are going to use for the client to conclude the diagnosis of fecal incontinence and also to understand the underlying pathophysiology which is causing the development of fecal incontinence. So I hope till here you understood the concept regarding the fecal incontinence, how it may affect, what can be the causes and disease conditions will be associated with the development of this process of fecal incontinence. We have also seen about the diagnostic methods which will be often or commonly used in a clinical setup to find out the underlying pathophysiology and the presence of fecal incontinence and to conclude the diagnosis. We are going to continue the discussion of fecal incontinence. So, as we have learned the basic concept of fecal incontinence in the previous one, we have also seen the probable causes, the diagnostic approach which will be often used to diagnose the underlying condition and the presence of fecal incontinence. Here, we are going to learn about the treatment or the management of the patient with fecal incontinence, as well as we are going to see some basic nurses' role and responsibilities to manage the client with this particular condition. So let's get started with the topic of the treatment of fecal incontinence. So definitely it has to be kept in your mind that the treatment of the fecal incontinence often will be depending on the underlying pathophysiological process. So whatever the disease condition is causing the fecal incontinence, that particular disease condition here will be treated. Now, we are going to see some definitive treatment procedure which will be commonly suggested to the client to manage the condition of fecal incontinence. So first we're going to learn regarding the fecal incontinence, which will be almost always associated with fecal impaction and its management. So often we are going to see a client with fecal impaction often will be showing the symptoms of fecal incontinence. So this particular scenario will be definitely managing or managed with a manual disimpaction initially. Now, manual disimpaction definitely will be helping to removal of the hard fecal masses from the rectal area, which will be ultimately reducing the symptoms of fecal incontinence. The next is cleansing enema will be often administered for this client with fecal impaction to reduce the overload into the anorectal area, ultimately which will be also resolving the problem of fecal incontinence. Now, to prevent the recurrence of the fecal impaction associated fecal incontinence, it is suggested to the client to maintain a normal stool consistency and to maintain a regular bowel pattern. So we are going to see basically here the bowel management program will be administered for individual client where they will be taught about a maintenance of a normal bowel habit, maintenance of a proper food and dietary intake, maintenance of a hydration of the body, which will be improving the defecation process. Now, definitely, it includes the regular defecation program, a high fiber diet, and increased fluid intake, as I have mentioned before. So, that is how we are going to administer the bowel control programming or the bowel management programming for a client who is suffering from fecal incontinence associated with fecal impaction. So in the next case, we are going to see if there is presence of any damage to the sphincter of the anus, we are going to see damaged sphincter will be repaired through a surgical technique. Now, through the surgical technique, often the client will be managed with the fecal incontinence. Other measures often includes the dietary management. So, dietary fiber supplementation, which will be basically a bulk forming laxatives, also can be used. Like psyllium, also will be used to maintain a normal bowel habit and normal fecal consistency within or among the client who are having more prone to develop with severe constipation or fecal incontinence. The client with high risk of the development of fecal incontinence or with the presence of a condition of fecal incontinence often will be suggested to avoid the products which cause rectal irritation or which increase the chances of the development of diarrhea. Now, through this dietary management, definitely we are going to teach the client or we are going to help the client to manage the condition of fecal incontinence. Anti-diarrheal agent also would be used for those clients who are suffering from severe and frequent diarrhea and which will be ultimately causing the presence of fecal incontinence. So anti-diarrheal agent will be definitely helping to manage the fecal incontinence even for these individuals. Now, certain exercise would be definitely suggested to the client. So Kegel exercise is one of the most important exercise would be demonstrated to the client to maintain or to improve the muscular strength and tone into the anorectal area, which will be ultimately reducing the chances of the development of fecal incontinence. The next comes is biofeedback therapy. Often the biofeedback therapy would be used for the client to manage the fecal incontinence in a clinical setup. Certain injectable agents also would be included in the management that includes the dextranomur. Even hyaluronic acid will be injected into the mucosa, which will be ultimately reducing the fecal incontinence. Now, as we have mentioned about the other techniques, now we will be learning about the surgical techniques which often would be used for the client with fecal incontinence and their management. Often most of the client will be present with some damage of the anorectal sphincter, which will be ultimately causing the development of this condition of fecal incontinence. That is the reason sphincter repair procedure often will be suggested or will be done for the client. The next condition is colostomy will be done if there is no absolute presence of sphincter disabilities present, but due to some other pathological condition, if the client has developed with fecal incontinence, we are going to see the colostomy procedure will be performed where the client will be managed with the fecal incontinence with this particular procedure. Now, as we have learned about basic concept of the management of fecal incontinence, we have also studied regarding the basic or the commonest surgical technique which will be often used for the client with this condition. Now we will be learning about the nursing management. Now it is very important point to note down, as I have mentioned before also, that basically the underlying treatment and the treatment towards it should be necessary to manage the condition of fecal incontinence. So here, nurse plays a very important role to manage the client with this condition. So in a basic way, definitely there should be a thorough history collection and physical examination should be performed by a nurse, through which our nurses will be able to identify the problems which are present among the client, as well as they can formulate a prioritized nursing diagnosis depends on the patient need. So, as I have mentioned, if there is a establishment of underlying pathophysiological process here, definitely nursing management also will be focusing to manage those particular underlying condition. But in some cases, we are going to see there will be no absolute underlying reason will be founded for some client. There, the nurse plays a very important role to manage the fecal incontinence, as well as they also plays a very important role to help the individual to change their lifestyle and also to cope up with the particular scenario where they're suffering from fecal incontinence. So here nurses basically will be focusing to help the client to re-establish a predictable pattern of defecation. The next, definitely a nurse should ask about their bowel pattern before the incontinence has been developed. This two information definitely helps a nurse to plan their bowel pattern and helps to administer the bowel management in an effective way for our client who is suffering from fecal incontinence. So, current bowel habits, the stool consistency, frequency, and other associative symptoms. Pain during the time of defecation and a feeling of incomplete defecation. This all data should be collected by a nurse from a client who is suffering from fecal incontinence. Now, while performing the physical examination, the perineal area has to be checked to find out whether there is any sign or symptoms is present related to the disrupted skin integrity, or any signs is present which is indicating that the client is more likely to develop with fungal infection, which is a very common complication associated with fecal incontinence. So even here, the nurses would be asking about their daily activities of the client, as well as whether the daily activities are interrupted by their fecal incontinence or this condition. That also have to be noted, or basically the degree of the disturbance of the daily activities also have to be noted. The Bristol stool scale will be used in a clinical setup by a nurse to assess the stool consistency for client with fecal incontinence. Incontinence associated dermatitis are very commonly seen. That is the reason the perineal area has to be checked by a nurse for the presence of erythema, any skin erosion, or any presence of rashes or any discoloration into the perineal and genital area. Even the upper thigh of the client would be checked by others. Now, the nursing diagnosis often includes the bowel incontinence related to inability to control the bowel function. The second prioritized nursing diagnosis often associated with fecal incontinence includes self-care deficit related to inability to manage the bowel evacuation. The next is risk for situational low self-esteem, which will be often related to the inability to control their bowel movement. And the fourth nursing diagnosis often includes the risk for impaired skin integrity related to the fecal incontinence. So I hope this all are the prioritized nursing diagnosis would be formed for a client who is suffering from fecal incontinence. Now, generally, we are going to learn about the nursing planning here. So, the goal of the nursing care here would include have a predictable bowel elimination or decide a predictable bowel elimination for our client to reduce the chances of fecal incontinence. Maintain the perineal skin integrity should be included into the goal or to the plan of nursing care. The next part is definitely precipitate the work and social activities of the client. Here also the nurse should improve their working and social interaction ability of the client who is suffering from fecal incontinence. Avoiding of self-esteem or lower self-esteem or improving the self-esteem should be or should be included as a plan of goal into the nursing care. Now we are going to learn about the nursing implementations here. So first and foremost important thing is here the time schedule will be done for the fecal defecation as a bowel management program as I have mentioned before. The next condition is often small phosphate enemas or cleansing enemas would be used for the client with fecal incontinence, which will be decreasing the frequency of fecal incontinence for our client. Now, soon after a person is developing with a regular bowel pattern or establishing a proper regular pattern of evacuation, this enema should be stopped to administer for our client. Digital stimulation is also a well-known method. If necessary, our client would be demonstrated with the digital stimulation method of evacuation. Irrigation of rectum and colon at regular interval would be suggested to the client if they are having any sign and symptoms associated with fecal impaction and fecal incontinence for a chronicle time. Now, maintenance of the perineal skin integrity definitely would be done by a nurse. Here, the nurse would be definitely cleaning the perineal and vaginal area. They will be applying the antifungal moisturizer if needed. Maintenance of the moisture and maintenance of a proper air circulation into the perineal and vaginal area should be ensured by a nurse. Generally, here the client would be suggested to wear very loose and comfortable cloths and avoid the irritated material or irritating material which will increase the chances of the development of impaired skin integrity into the perineal or vaginal area. Food and fluid intake also should be taught or should be explained about proper dietary measures and fluid intake in case of fecal incontinence. Here, the food which are considered to be bowel irritants should be avoided by the patient. A proper maintenance of fluid and food intake definitely helps a person to maintain a healthy bowel regulation, which will be ultimately reducing the chances of the development of fecal incontinence in patient. Exercise also should be suggested as we have mentioned. Kegel exercise here basically should be preferable and demonstrated to the client, as well as they would be definitely suggested to go for a proper ambulation and a mild to moderate exercise or physical exercise, which will be ultimately increasing the chances of to maintain a regular bowel pattern, and ultimately it will be preventing the development of fecal incontinence. So ultimately, in a clinical setup, definitely a nurses would be observing the client directly, but while the client is having a discharge plan, definitely it is a nurse's role to teach the client and caregiver regarding a proper dietary intake, the defecation timing and pattern, exercise pattern, a proper rest, sleep, and activity pacing would be done by a nurse. Adherence to the treatment regimen and to follow a proper follow up at regular interval, usage of protective pads would be demonstrated to the client by a nurse. Hygiene maintenance plays here a very important role to prevent any infectious disease to occur in the perineal region. So all the protocols which a person should be follow, a nurse should demonstrate. So this were regarding the fecal incontinence. I hope now you are completely understood the concept of this disease condition, the related causes as well as the diagnostic measure to find out the underlying cause. We have also seen the treatment, the surgical treatment as well as the nursing management of a patient with fecal incontinence. So I hope you have enjoyed the session. Thank you so much for attending this one. We will meet you guys in the next session.